Hi, I'm Dr. Fragomen at the Hospital for Special Surgery. I'm here to talk to you about ankle distraction arthroplasty. What I'd specifically like to discuss is to introduce how to do adjustments to the external fixator. This is really for patients who already have the external fixator in place and are requested by myself or Dr. Rosbrook to adjust the frame. This would be to distract the joint surface and create the space we need for the proper biological environment to create the cartilage. The adjustments are going to be done either by one of our staff or by the patient on their own. First, I'd like to demonstrate how to do this adjustment on this model of a bone. For those patients who are undergoing ankle distraction, some will need to adjust the external fixator or the frame once they get home. And these home distraction adjustments are very easy to do. It's a three-step process. Step one is to unlock this top nut. So you use your wrench, turn it to unlock it, and you can see that the nut is loose. Okay, and then we're going to advance this 1 millimeter. How do I know it's a millimeter? Well, this is a square nut. So that's 1 dot, 2 dots, 3 dots, 4 dots, and then back to dot 1. That's 1 millimeter. So that's step 2, and step 3 is to lock this back down. Just like that, and you can even use the round part of the wrench to really get it tight. Next, let's look at how to do the same adjustment on a patient in the office. Sometimes patients will come to the office with the frame on, and I'll need to do an additional millimeter or 2 millimeters of adjusting in the office. Okay, we're going to show another way of doing the distraction by holding the hinge. So here my assistant Hal is holding the hinge with one wrench, and he's loosening the top nut with the other wrench. And then he's going to do 2 millimeters of distraction. That was 1 millimeter. That's 2 millimeters. Now he's going to lock it down. Good. Let's look at a patient who we've already shown how to do this adjustment, and you'll see how easily he's able to do the adjustment on his own. That's the fourth one. That's it. Yep. You've seen how to do the adjustments now, and I think you'd be quite comfortable doing these on your own and less intimidated by the whole process. If it's done in the office or done at home, I think you've seen it's really no big deal.